The Thomas test is a clinical exam responsible for checking tightness of the iliopsoas muscle, the rectus femoris muscle, tensor fascia lata, as well as the sartorius. The patient is positioned supine with about 1/3 of the thigh dropped off the edge of the clinical exam table. In this case, we'll be assessing the left lower extremity. The Thomas test, the contralateral limb is flexed at the knee as well as at the hip. If the Thomas test is positive for tightness of the iliopsoas, the patient will show slight hip flexion in this position. If there is tightness of the rectus femoris muscle, the knee will slightly extend. If there is tightness of the tensor fascia lata, the hip will abduct away from the midline of the body. If all three of these positions of hip flexion, knee extension, and hip abduction are present, then clinically we would also need to assess for tightness in the sartorius muscle.